Hello. On this FERNE educational video, we will discuss the care of emergency department patients with dizziness and vertigo in an attempt to appropriately diagnose and treat serious central etiologies. In this case, we'll be discussing the negative Big 5 hints plus, in parentheses plus, exam findings on bedside physical exam. My name is Ed Sloan. I'm with FERNE.org. More about FERNE to follow. So what does it mean to have negative Big 5 hints plus findings? Well, to go through the hints plus central vertical signs, that is, signs that would suggest a central etiology, consider vertical, torsional, bilateral fast nystagmus, or no nystagmus at all. This would suggest a central etiology. If you have a normal head impulse test bilaterally, that is, the eyes remain central and there's no corrective saccade on one side, it means that both vestibular systems are working appropriately, and it's not possible to say it is due to a peripheral vestibular illness. If vertical skew correction is seen, that when you cover and uncover each of the eyes alternately, if there's a correction seen because the eyes aren't aligned vertically, this would suggest a central etiology. Other central neurological findings are listed here, including hearing loss, which is part of the actual hints plus exam. Note that pain and temperature sensory loss are findings related to a central vertigo etiology, not just light touch abnormality. Truncal ataxia and ataxic gait are also important suggestive findings related to a central etiology. And of course, anything related to extremity weakness, facial asymmetry, aphasia, or altered mental status would suggest an anterior circulation stroke. So, here are the findings that are red light. That means if any of them are noted, consider a central etiology. No unilateral saccade on head impulse. Abnormal bilateral fast vertical rotational or no nystagmus at all. A positive test of skew. A positive hearing loss. Noted truncal ataxia or gait abnormality and or anterior stroke signs. So, the negative Big 5, where you need to have all of these negative in order to determine that the etiology of the vertigo is peripheral, you need to have one side with a corrective saccade because one peripheral vestibular system is ill unilaterally. You need unilateral horizontal nystagmus only, not bilateral, not vertical, not rotational. The pupils need to be aligned vertically when testing skew. There need to be no posterior neurosigns, especially hearing loss, which is part of the hints plus. A patient needs to be able to sit, stand up, and walk, and there need to be no anterior stroke, symptoms such as weakness, face abnormalities, speech abnormalities, or altered mental status. And one more note about the whole concept about an hints exam noting a peripheral etiology. In order to make the diagnosis of vestibular neuritis in vertigo, 1, you need unilateral fast nystagmus. In other words, you need to have nystagmus that is consistently going in one direction with the fast component. And second, you need a unilateral saccade on the head impulse test. In other words, you must have a head impulse test that is positive for unilateral corrective saccade in order for the diagnosis to be peripheral vestibular neuritis. In other words, one vestibular system must be malfunctioning and the head impulse test must show a unilateral saccade. If there's no unilateral saccade on head impulse test, this is bad. It means there's a likely central etiology. Again, my name is Ed Sloan. I'm FERNE President and Board Chair. I have no financial conflicts. Please go to our FERNE.org website and our YouTube channel for more content related to the optimal care of the patient with dizziness and vertigo. And follow us on social media for more real-time information on the care of all patients with neurological illnesses, injuries, and emergencies, FERNE.org. So you can leave a comment here on our YouTube channel or send us an email at FERNE.org@gmail.com. Have a good day, and thank you.